Lung cancer is the leading cause of cancer-related deaths worldwide.
Yeah, November's Lung Cancer Awareness Month. CHI Health is working to make sure more people can get screened. KETV News Watch 7's Anna Baney's live with the chief of thoracic surgery at CHI CUMC Bergen Mercy.
Yeah, good morning, Jack and Melissa. We're back with Dr. Erin Gillespie, and earlier we talked about screenings and their importance, and CHI Health is looking to make them more accessible. Can you tell us a little bit more about your pilot initiative?
Absolutely. Thank you so much for asking. So one of the things that we know is that women are doing a great job at getting their mammograms. So we're looking actually to make a new partnership. So for all of our women who are coming in to get screened for breast cancer, we're now going to offer a questionnaire screening to see if they qualify for lung cancer screening as well. We're trying to make this a one-stop shop so you can come in, get your mammogram. If you qualify, get your CT screen as well for lung cancer. We do know that women who have a history of breast cancer, who are breast cancer survivors, are at increased risk for secondary cancer. So really important that we're getting these women screened.
And can you tell us a little bit more about the Screen Your Spouse initiative?
Absolutely. So that's our second initiative that we're launching as well, and I'm really excited about this one too. We know that a lot of people who live in the same households share risks. So they may both be tobacco users, or they may both be exposed to radon. So we want to make sure that we're screening every single person that we can. So every primary care doctor, we're encouraging every single person who's in front of you, if you have a patient who meets qualifications, ask their spouse, ask their sibling, ask who's in that room there today to see if they qualify as well. So please, please, please make sure you're screening not only your patients, but screening their spouses too.
And what are the different types of screenings?
Yeah, so that's a really important question. So the screening for lung cancer is a CT scan, but it's a little different than the normal CT scan. We call this one a low dose. It actually uses about the same amount of radiation as a chest x-ray. Only takes seconds to complete, and you will have a wonderful navigator call you with the results and talk you through the next steps.
Awesome. Well, thank you, Dr. Erin. And there are some common misconceptions when it comes to lung cancer. Stay with us in the next half hour to hear more about other factors that could play a role in that. And cigarette smokers are not the only people at risk. Jack, Melissa, back to you.
All right, great information. Thank you, Anna.